For months, news outlets and social media sites have been flooding our screens with images and headlines about the COVID-19 pandemic. But just how accurate has the media's portrayal of Michigan's experience with COVID-19 been? Choosing to remain anonymous, a West Michigan native gave Beyond the Rock her side of the story as a respiratory therapist serving on the front lines in Detroit.
We're there for one reason. It's to help the patients, it's to do our jobs, it's to do our jobs well, and hopefully, get these patients off the vents and back home to their families.
Reports of shortages of medical and protective equipment have been circling the media for weeks. But according to this frontline worker, her access to these tools in Detroit doesn't seem to match the hysteria.
We have not had any issues with shortages. We have a surplus, actually. There's only maybe one or two hospitals that are having issues with the PPE and not having enough ventilators, but we've been able to, share our equipment.
With some of the strictest social distancing policies in the country, Michigan's numbers are baffling.
Every death is labeled a COVID death. These patients have been in the hospital. Unfortunately, they might have gotten COVID while we were there, but to label them a COVID death, it's frustrating because that's not what killed them.
If our own frontline workers can attest to inaccurate reports, is the media really doing its job? This has been Kelley with Beyond the Rock, signing off.